We have been listening to President Trump and members of the coronavirus task force who have been briefing reporters at the White House. Good evening to you. I'm Ari Melber, anchoring our special coverage. Let me tell you exactly what we just saw, including some fact checks, and then we'll bring in our experts. President Trump today basically doubling down on comments that he made overnight that disturbed many experts because he suggested that he may already be looking to ease up on some of these medically required restrictions in place to slow the spread of the coronavirus in the United States, discussing the idea that the administration would reassess its path forward as soon as 15 days. That would be March 30th. That, of course, cuts against the medical guidance of some of his own experts, particularly because there's a 2-week or more lag on the very confirmed cases that we have. Now, before we bring in our experts, I want to tell you the very latest we know tonight about this virus. The World Health Organization warning the pandemic is still today currently, quote, accelerating. Well, here's the map, 41,000 cases in the U.S., a number that has actually doubled just over the weekend since Friday night, and we have now over 450 deaths inside the United States. We can also report for you the list of states that are urging people to stay home continuing to grow today. It includes Massachusetts, Indiana, Ohio, Delaware, Michigan, and Louisiana. All told, we are nearing all-time highs for the precautions being taken across the country because we have over 100 million Americans, that's about 1 in 3 of you, who are now subject to some type of stay-at-home guidance, precaution, or government order. Meanwhile, when we talk about some of the conflicting statements that are coming out of the Trump administration, today Surgeon General Jerome Adams warning the coming week will actually be critical to slowing the spread of the virus.
I want America to understand this week it's going to get bad, and we really need to come together as a nation. Every single day counts. Every single second counts. And right now, there are not enough people out there who are taking this seriously, and you just see it looking in California, people on the beaches. You see it in Washington, D.C., the people out looking at the cherry blossoms. We need to take this seriously.
Yesterday, meanwhile, President Trump approving a new request to activate the National Guard to assist in 3 specific states that have been hit hardest by the coronavirus pandemic. That's Washington State, California, and New York, which has become something of an epicenter with a surge of new cases. Now, Donald Trump, again, balancing what his own medical experts and his own CDC advises, as well as what we've seen throughout this process, which is times where the president will say one thing and then say another. Basically today, doubling down on the idea that regardless of this new information, the new numbers we've just showed you, his idea is that America will soon be back open for business.
A lot sooner than 3 or 4 months that somebody was suggesting. A lot sooner. We cannot let the cure be worse than the problem itself. We're not going to let the cure be worse than the problem. At the end of the 15-day period, we'll make a decision as to which way we want to go, where we want to go, the timing, and essentially we're referring to the timing of the opening, essentially the opening of our country, because we have it pretty well shut down in order to get rid of this invisible enemy.
Now we're joined by Peter Baker, Chief White House Correspondent for the New York Times, Andy Slavitt, a former acting administrator of Medicare Services for the United States, Susan Michael Strasser, Assistant Professor at Columbia University School of Public Health, and we are joined by a former member of the Trump administration. David Shulkin was the Secretary of Veterans Affairs for President Trump. Hello to everyone. Andy, first of all, a fact check. What did you hear that computed for you in this briefing, and anything you want to warn our viewers that was misleading?
I think what we're hearing is a left shoulder, right shoulder, Larry Kudlow, Dr. Burke, that is going to be whispering in the president's ear. And I think the question we're going to have out of the White House is, who does he listen to? Sadly, there is no shutting and opening of the country. There is a path. The path is get widespread testing, widespread intelligence, widespread capabilities out, buy yourself some time, buy our hospitals some time. And then if you want to let businesses reopen, let them reopen and require temperatures to be taken as people walk in. And so there's a smart way to do this. And I completely understand the president's frustration. I completely understand the left shoulder, right shoulder. I think his tendency, I think our fear is his tendency will be to jump towards the Kudlow tendency. And if that's the case, the governors of the country are going to have to stay strong. And we will have some governors that will will stay strong because they have to, and we may have others that don't. And I urge us all to take our own minds and understand what this really means.
Right. You're speaking about the tension across the government response and across the country, personified by sort of a medical expert and an economic czar. Peter Baker, I mean, to paraphrase, and I see, Peter, you have a nice pet behind you, and it is National Puppy Day, I should mention. So we welcome that. It's appropriate.
Yeah,
we're all working from home here. I love it.
Bring your dog to work day.
Bring your dog to work. If we can get any levity out of this, we'll take nice camera time with pets. But what Andy's really saying here is that if it's Dr. Jekyll and Mr. Hyde, with no disrespect implied to Larry Kudlow, it could be Dr. Fauci and Mr. Kudlow. And a lot of Americans and experts at this juncture, at this early juncture in trying to stem this thing, seem to be more concerned that Dr. Fauci's expertise is heard. He, of course, not even present at today's briefing, Peter.
Yeah, I think that the president's point of view and the point of view of some of the people in the White House is that perhaps they have gone too far. This is a debate that's happening right now. Is in fact the shutting down the economy, passage of a $2 trillion deficit spending economic package. At what point have they, in their view, potentially overreacted? This is the debate, as we were just saying, between the economic wing of the White House and the health wing of the White House. The economic wing is saying, well, when do the health guys get to decide all policy? Why isn't this balanced out some way? So you see the president eager, anxious to be able to try to pivot, to be able to move on, to say, look, there is a future coming. Within a week, we'll be able to tell you something positive about the reopening of the country, even as these numbers seem to get worse and worse and worse. And what will be interesting to see is whether he actually does that at the end of this week, or whether, in fact, the reality of this week that the Surgeon General just outlined on television this morning, in fact, becomes so palpable that there's no way to go as far as he would like to go in terms of beginning to lift these restrictions. He said he sees this as weeks, but you hear a lot of experts say actually months may be required.
Yeah, and both of you alluding to, of course, the ongoing clash in Congress, where any other day in any other news cycle, the idea of another $1 trillion, give or take, coming out of the Congress would be the biggest story in the world. Here, it obviously comes in second to the medical emergency, although they're related. We're going to keep our entire expert panel here for a more response and fact-checking of the Trump administration plans. But turning to that congressional story, I want to bring in U.S. Senator Kirsten Gillibrand of New York, who is taking a little time out of a busy evening to join us. I want to get your views on what Congress is doing and the standoff in the Senate. But first, any reaction to what we heard out of the press conference here, and specifically Donald Trump already sort of trying to tout the idea that we have a return to normalcy soon?
Well, the president isn't making any sense. And in fact, we have a major health crisis in front of us. I've talked to almost every hospital in New York State, and they're still worried about getting basic personal protective equipment, getting more masks, getting more gowns, getting more ventilation machines. This is a huge crisis. And for him to downplay it because he's worried about stock prices or his own economy, it's shocking. It's a lack of leadership. And so what Congress is working on right now is how do we support our small businesses? How do we support employees who have lost their jobs through no fault of their own? How do we make sure people can have sick days and paid leave days? How do we make sure that those who cannot be working because their children are home because the schools are closed, how can they still keep putting food on the table? Everybody has a purpose right now. And our purpose as individuals is to stay at home, to keep our families safe, to make sure we don't transmit a virus more than it needs to be transmitted. Every time you choose to stay at home and not go look at the cherry blossoms or not go to the beach, you are making a choice to not transmit this virus and to keep more people safe. That is the right choice, and we all have a duty to do that.
Understood. Take a listen to something that Vice President Pence, who is the leader of the task force, said.
We're going to give guidance out of HHS and DHS today about how those workers, even if they've been exposed to someone with coronavirus, as long as they don't have symptoms, would be able to return to work immediately, wear a mask for 2 weeks, but otherwise return to the important roles that they play in all our communities.
All right.
Your response, Senator?
Well, the CDC and the doctors have told us that if you've been exposed, you need to stay at home. You need to be away from other people for 2 full weeks, and you cannot go back to work for 2 full weeks. And so for him to imply that if you don't have symptoms, you're fine, that's contrary to what the doctors have told us. They've told us you can transmit this virus and be asymptomatic. You can transmit this virus before you're actually showing your symptoms. We have people in the U.S. Senate whose husbands are sick, who are on oxygen right now because of the coronavirus. I've talked to families all across New York whose children, whose parents are sick with the coronavirus. This is a real epidemic, and again, for the president and the vice president to downplay this because of their stock portfolios, again, is shocking and really antithetical to the moment we're in. And that's why Congress is working hard to try to meet the needs of the American people, because the president and his administration certainly aren't.
So let's get right into that. I've tried to remind viewers, because there's so many different things going on, that we did see some rare bipartisan progress. And so credit to anyone involved in that, and both parties on some speedy initial bills, call them, 1 and 2. This bill number 3, though, which has a ton of money in it, has become a huge clash. I want to give you a chance to update everyone here watching on what the latest is in that, and a chance to respond to what we heard. We were just, of course, showing the president and his views. We also heard from Senator McConnell, basically accusing your party of, quote unquote, playing politics and being partisan about this. So I wanted to get your update on all of that.
Well, those comments are absolutely absurd. The first version of this bill that Mitch McConnell put forward was outrageous. He literally wanted to create a $500 billion slush fund for Steve Mnuchin to give to his donors or to his favorites or to Trump's businesses with no oversight and no accountability. They also didn't have enough money for hospitals, the personal protective equipment, for the supplies that people are desperate for. They didn't have enough money for small businesses that are going out of business, and they didn't have enough money or even a way to help employees that were losing their jobs and not able to provide for their families, pay their bills. So the good news is Senator Schumer and the Democrats have been working 24/7 over the last 2 days to get a bipartisan solution. They are very close to having a deal in place that Democrats will feel comfortable supporting and putting forward. These type of ideas will include money for workers, to make sure this is a workers' first bill, money for small businesses, making sure people who are sick can stay home, making sure
and
they
that
have
would
access
pass
to health care.
By when? When might that pass by?
Our goal is to have that bill written in the next couple of days and be able to vote on it and get it into the economy.
Understood. And I think a lot of people keeping their eye on that part of this as well. Senator Gillibrand, a busy evening in the Congress, a lot of folks in government working all kinds of hours. Appreciate you making some time for us.
Thank you.
Thank you. I'm going to bring back in our panel of experts, Peter Baker, Andy Slavitt, Susan Michael Strasser, and David Shulkin. David, interesting to turn to you as someone who served in the Trump administration with a healthcare portfolio. Your view of how the president is handling this, and given your close-up experience, again, Dr. Fauci missing from today's press briefing. He's missed some previously, but he certainly made waves over the weekend here in speaking out and saying in his own measured sort of Brooklyn doctor way that he wasn't trying to create any extra rift with the president. He's just going to get the facts out, but he will continue to fact-check the president in real time because there has been misinformation.
Well, Ari, I'm not at all surprised to hear what the president said today. I've spent a great deal of time with the president and had many discussions with him. He's a man who always follows his gut. He is always willing to offer an opinion, and that's why it's so important that people who are around him have a very defined point of view, feel strongly about their principles, and continue to advocate for what they think is best, because the president will listen. It's when you don't push back, when you don't share your point of view with the president, that he tends to follow the way that he instinctually wants to handle a problem. So I think Dr. Fauci is doing an incredible job of sticking to what he believes in. He is a man of science. He follows his principles. He's doing it in a nice way that He's willing to work with the president, but he's not willing to compromise on what he thinks is right for the American people. And I think that's what you have to do, and that will get us the best result. The president, of course, has a correct point of view that these unintended consequences of social isolation, of the economic harm that many Americans are feeling, are very serious. But we're dealing with a health crisis, not necessarily an economic crisis. And the virus is going to respond to us addressing it in an appropriate health way, not in dealing with the economics here.
Yeah, I mean, that takes us perfectly to Susan and your expertise here, because it's one thing to say that many people are worried about the secondary economic effects. I mean, this is a huge problem for everyone, and the less money you have and the more that you're in a day-to-day job scenario, the scarier it is, for sure. And yet we're hearing from all the experts that the way the president is talking about trying to rush through or skip over the containment period would not only make the healthcare crisis worse, but it would ultimately potentially make the economic crisis worse. And Hong Kong is one of several places that people point to where trying to rush past this sort of containment period can actually exacerbate it. I'm curious if you could walk us through your views.
I'll give the analogy of medicine that we have to take when we're ill. I am a public health professional, doctor of public health, but first and foremost, I'm a nurse. And sometimes patients have to take treatment that's very difficult to swallow or has very severe side effects. And that's where we are right now. Quarantine, self-isolation, it is very difficult. It's difficult on all of us. I haven't been outside all day today. I see my daughter out of school. She might not have her senior prom. These are heart-wrenching things.
Sure.
But it's what we must do to get ahead of this epidemic. And 100%, we have to do it now or do it later. And right now, the most important thing is protecting our health workers who are begging for protective equipment and helping our elderly to stay at home, and for all of us to do what we should do as citizens. Stay home, listen to the guidance of Dr. Fauci and Dr. Birx. They know what they are doing. They are data-driven. They are using science to protect all of us, and they are the experts in this regard.
So in your view, when the president says, well, maybe we can just skip ahead and get people back to work soon or end of the month, that's wrong, half right. What's your view?
I would just say there's no shortcut here, and we have to continue to self-isolate until we know that it is safe to do otherwise. And that is the priority. In public health, we have to weigh the benefits to individuals and society. And right now, society needs healthcare. It needs to address this virus, stop this virus. That is first and foremost.
That makes sense. You mentioned you haven't left today. It's making me wonder whether Peter Baker has left the house today and walked the dog. We may never know.
The dog has been walked. I was not the dog walker today. I was yesterday, though, in fairness.
So with all of that wrapped together, from the fact that there are many people suffering in real ways, but there's also, as mentioned, all of the ways that people are just ground down by this, Peter, what do you think, as someone who watches this White House, what do you think we can learn? I mean, another point that we saw in the briefing today was the president trying to goad one of the members of the task force into saying, oh, well, eventually the restrictions on the press briefing area will be lifted and more people will be able to sit in there. Folks like yourself and many of our viewers who follow this will recall, this is a White House that's never held regular press briefings. It took a pandemic to force that to even happen. And so it does put a spotlight on this president's uniquely disruptive approach to governing in the first place. Peter.
Well, we're in an awkward position where we all would like to go to the briefing, but in fact, we all know that, in fact, we shouldn't all go to the briefing. The Correspondents Association last week limited the number of reporters who could sit in the seats there. As of today, they limited it even further to keep reporters further away, further at distance. And one of our colleagues, we understand now, has some symptoms and is being tested. So we don't know where that will end up. But that's what the president was referring to at the beginning of that briefing. And of course, that very room is sort of ground zero for the conversation that we're having about what is appropriate right now in this society. The president is up there with several different people every day, and people have commented on that online. People have commented on that. Why is he so close to other people if, in fact, he's telling everybody else not to be? He has at least stopped shaking hands, so that example has finally stopped. But yeah, I think that we see in a microcosm there sort of the disruption you're talking about.
Yeah, and I'll give the final word on that to David, again, who served in the Trump administration. I mean, we've seen that in the reporting. We mentioned Dr. Fauci. We've seen reporting that Vice President Pence has been pushing harder to have more distancing in the briefings and in their work as a task force. But whether it's just the visual microcosm of it or not, here we are deep into this crisis, and it still seems that the administration is giving out advice that it's itself not always following.
Well, Ari, I think you saw the president's reaction when Dr. Birx said that she had a fever, and until he heard the results of her test, he physically walked away. I've spent a lot of time in that briefing room. That is a very small room, as Peter knows. Yeah. It looks big on television, but it's a very small space, and I do think I'm pleased to see that they are putting in the social distancing, but I think we all need to model the behavior that we want others to follow, and that means that we really do need to stay away from each other, because this is a virus that has the ability to spread up to 6 feet from one another, and it's different, as the president has said. None of us are used to this, but this is a new world. We all need to begin to start acting differently.
Yeah, I mean, for those of us in reporting or working who've been in the White House, it's an old building with very small areas. I mean, the hallways are tight. The coveted offices tend to be small because they're coveted only by proximity to the Oval. And so this is another reminder that old buildings, obviously lower income areas, places where people have smaller space and less freedom of movement, are actually places for different reasons, are more susceptible to the spread. This has been a really great panel of government and journalistic and medical experts to help guide us through what we just heard. So I want to thank each of you, Peter Baker, Andy Slavitt, Susan Michael Strasser, and David Shulkin. Thank you, and be safe. We're going to fit in a break here, but when we come back, we're going to get into how America's not only dealing with the virus, but also all of these problems around the facts. Don't go anywhere. I'm Ari Melber, and we will be right back. Welcome back. There are many officials confronting this coronavirus outbreak, but one has stood out. Dr. Anthony Fauci emerging as the key voice of reason, the public relying on him for the facts, even when there has been spin and worse from the president. Now, as we just saw tonight, Dr. Fauci was not visible at this briefing tonight. His absence comes after he publicly addressed the challenges of working with this president. Fauci telling Maureen Dowd of the New York Times, for example, "I've been telling the president things he doesn't want to hear. It's a risky business. If he's going to get pissed off, he's going to get pissed off." Thankfully, he is not, interestingly. And when asked about the president's misleading statements, Fauci suggested a diplomatic approach works best, telling Science in a much-read article over this weekend, "I can't jump in front of the microphone and push him down." Meanwhile, despite Trump's rhetoric, Fauci says he will never, ever say the words, quote, Chinese virus. Today, the New York Times also reporting that Trump has become frustrated with Fauci's blunt approach at the briefing lectern, which often contradicts things the president has just said. We're joined now by John Brennan, who was former CIA director under President Obama and overlapped in the transition period with this administration. Good evening to you, sir.
Good evening, Harry.
You are someone that has dealt with this, knows it intimately, and I think viewers have seen it, including your battles at times with the president, him taking shots at you and others. I wonder how you view this fight with Dr. Fauci, because if there's a hierarchy of concerns in CIA parlance, sometimes we hear about the level of confidence, and the president is entitled to make his public debates over things that devolve into policy, devolve into the level of confidence. And yet this is an area where the medical science seems so clear. Do you view it as worse in some regard when he is clashing with the medical experts?
Well, Ari, two things. One is that I was the Homeland Security Advisor to President Obama in 2009 when we had to deal with the H1N1 crisis. And the contrast between President Obama and Donald Trump could not be more stark in terms of President Obama's reliance and thirst for information in terms of data, science, and facts. He wanted to learn from the medical professionals. Secondly, Tony Fauci, we work with very, very closely. He's been a national treasure for years. He helped us understand aspects of the H1N1 in terms of transmissibility, lethality, what type of antivirals might be applicable here. And Tony Fauci is the type of person that we in the White House were dependent on to make sure that he was able to guide our policy decisions. And so when I see that Tony Fauci behind Donald Trump is, having to close his eyes, and you can see he's very uncomfortable with the things that Donald Trump is saying, because Donald Trump does go on his gut instinct. He believes he's the know-it-all and he has the answers. Now is not the time to be playing know-it-all when people's lives are at stake. And so Tony Fauci, I'm just hoping he's taking care of himself. He's getting the rest he needs. But he is the type of person, along with the folks at CDC, that need to be guiding our policymakers so they make the right decisions that make the health of our country paramount. The economic issues will come behind it. But I know, having worked in the White House, that this is a very, very challenging issue. It was challenging for H1N1, and H1N1 paled in comparison to the complexity and to the challenges that we face right now with coronavirus, which is much more lethal, much more prevalent, much more contagious, and it's going to be something that's going to be with us for many, many weeks and months, I think, to come.
Appreciate your clarity there. You mentioned the rest. I mean, Dr. Fauci mentioned to the New York Times that he was sleeping at one point only 3 hours a night. He's 79. He's upped it, he says, to 4 or 5 hours in the last few days. He's become something of a national treasure here, as you mentioned, maybe just more visibly to more people. Here was the president putting his spin on preparedness. Take a listen.
Tony Fauci and all of the people, the talent that we have, would have loved to have had 3 or 4 months of additional time if you knew that this was going to be happening. They didn't have that time. They read about it in newspapers like everybody else. China was very secretive, okay?
From your knowledge, is this the kind of thing that experts in the federal government only read about in the newspapers?
No, and I think it's been clear that there have been intelligence briefings, and I'm sure briefings from health professionals that have been taking place for the last several months. I just think that Donald Trump has been in denial, and he continues to be in denial in terms of the magnitude, scope, and seriousness of this issue. And this is the time that even his critics want him to rise to the occasion, to lead this country and not just look for adulation and for people to be saying all great things about his leadership. Now, they really need to make sure that they're doing exactly what the health professionals want us to do, which is to ensure that we're going to be taking the measures that we need to in order to keep ourselves safe, because this disease, and that's what it is, an influenza, the coronavirus, it's really going to continue to sweep through our country unless we take these precautions now that Tony Fauci and others are not just recommending, they're pleading with the officials to do. And unfortunately, I think it's late already, and I'm hoping it's not going to become even later, because lives are on the line.
A lot of lives on the line. John Brennan working from home and giving us much needed context. Appreciate your time tonight, sir.
Thanks, Ari. Take care.
Thank you. I'm Ari Melber, anchoring our special coverage. We're going to fit in a break, and we will be right back. Thanks for spending the last 2 hours with us. MSNBC's continuing coverage of the coronavirus pandemic will be a part of all of this evening coverage. I will mention to you, I am Ari Melber. You can find me at 6 p.m. Eastern for The Beat again tomorrow night. You can find me online at Ari Melber on Facebook, Instagram, or wherever you get your news online. But don't go anywhere, because All In with Chris Hayes starts right now.